Absolutely. So this is so much fun. I'm so glad that you could join me on this podcast. You look beautiful
Oh,
as always.
thank you. So do you. You caught me at a good time because soon I'm going to have no time for, I've been saying a lot of no's to a lot of things because I just don't have the time. And you just caught me at a good time. I'm off today. And, so, and I wanted to do this for you because your family meant, it's a lot to me taking care of them. And you've been following me and I've been following you for a long time. So
Oh
it's
my
great to
gosh.
connect.
That warms my heart. I feel so like honored and special and blessed. And this has been amazing. That's how I know this is really important work that I'm doing and that you are coming alongside me to support and do because the
Oh,
people who
definitely.
have said yes have very similar stories around time. It's just I don't have time. I don't have time.
Yeah, it's the time.
But you and other very renowned people are saying, "Well, make the time. I got a flight to catch in 2 hours. Let's do this." So like it just means the world to me. And a part of this podcast really is to create a community in health where you know how we have our different associations or our girlfriends and we got our little these small communities that we're a part of, but it's almost
Yes,
like we need to be surrounded by people that support us with our health. And
I
I guess
agree.
I got the framework. I was listening to the Michelle Obama interview with her girlfriends and her mom, and she
Yeah.
was talking about having this community, and I was like, that's it. That's
I've listened to her interviews too.
like that's the basis of why I'm doing this. So she helped me really define what how I could present this podcast to the world, if you will. And so I don't know, she put like the pin in it and I was like, that's all I needed. That's what I was missing. And it gave me the I guess the framework of who to even ask. Like who are all the people out there that are really doing the work? You know, a lot of us go into professions for different reasons, but there are some people who are really passionate about what they do. And here we are. I'm in chapter 39 of my life. And the impact you made when I was 17 is still there. You know, you
Wow.
even Dr. Fable, I can't remember how I reached out to her recently.
Oh yeah, I took over her practice. I remember her.
Yeah, and I was like, "Do you remember what she told me when same day I think I had the flu?"
Yeah,
And it
yeah.
was during the 40 days fast. You know, my family was very, very faith centric. My mom is, and I remember telling her, and Rachel took me to the appointment. By the way, this is when they picked me up from Gerard, and
Yep.
she's like, "Ethel, you know, it's the flu. You know, the flu you have to eat." And I was like, I just looked at her. I said, I can't. And now that I'm older, I realized that was probably the worst thing to say
Yep.
to a
Yep.
primary
Yep.
care physician. She was like, "What do you mean you can't eat?" I was like, "Well, you see, we're fasting and we're not supposed to eat for 40 days." Until she was like,
Wow.
"Honey," and like literally, I just saw her kind of formulate in her mind, like, how do I talk to this 17-year-old kid about the importance of
Yeah.
nutrition and healing? And her words were something like this: "I don't think God will mind if you eat because you're not feeling well. So go ahead and eat, and I think you'll even get better." And then, something along those lines, and you and God will be fine. However, she said it, that stuck with me. And I was like, okay, I'll eat. And I literally went home and I started eating soup because I was not eating at all, like
Wow.
totally misinformed. And I recently wrote her a note about that. And she was like, it's people like you, patients like you, you're the reason why I do what I do. Like, I remember.
Yeah. Wow.
So, and she's great, and so are you, and you did a great job when you took over the practice. I
Thank
came
you.
to the practice because of you. I wanted
Wow.
to be treated by somebody who looked like me, somebody who had just accomplished what I wanted to do. And I think life helped me define that my impact wouldn't be as a medical doctor, but it would be
Hmm.
in the medicine of food as medicine. And that's
Yeah.
why I am doing what I need to do to formalize myself as a clinical nutritionist. So that'll be done next year.
Great. Congratulations.
Thank you. So I've been on this journey for over 20 years, but it's time to formalize it because the work I do is important, and I want people to take me seriously. Long
Great.
term.
And they will. And they will. You
Yeah.
are definitely impacting. You're very visible on LinkedIn, and I encourage you to keep doing it.
Thank you so much, Dr. Niles. So I want to toot your horn a little bit. I have your bio up, and I had just told myself, I'm not reading no more bios. They're too long. Nobody cares about where you went to school 40 years ago, you know. But I think your bio is powerful, and I'm going to take up the real estate to read it. And I've already told my viewers on LinkedIn and YouTube that to give me grace for reading Dr. Niles. I am healing through a concussion.
Oh,
So
wow.
I have a whole medical docu-series coming out about that. But, you know, there's just certain details it's a little challenging to commit to memory right now. So I'm going to go ahead and read this because I believe you deserve this. And I mean, this is amazing. So we've already dived into the podcast. So I'm going to say good morning, good afternoon, good evening, wherever you are in the world. As you know, my name is Ethel Richards, and I am the plant-based nutritionista here to inspire you to take your health back one meal at a time by eating more plants. And I'm just want to dive right into the bio of Dr. Niles. But before I do, I want to tell you what we're talking about today. We're going to be talking about the power of primary care and the importance of having a trusting, open, and collaborative relationship with your primary care provider. And Dr. Niles is one of the nation's most acclaimed family medicine physicians and financial experts. She's a board certified family medicine physician and fellow of the American Academy of Family Physicians, who is recognized as a speaker, consultant, and media personality. She is a sought after media expert in law and health policy who helped to bring secondhand smoke laws into the public's attention in my hometown, her hometown, Philadelphia. So Dr. Niles consistently cares for patients with complex medical histories, and as a result of her expertise and compassion, she has been able to improve the lives of these patients so they can be more productive in their communities. That's a community provider, guys. She is a sought after lecturer and teacher in her field, and her mission is to teach families how to create generational wealth by using her simple wealth building strategies. Dr. Niles earned her bachelor's at the University of Pennsylvania, her medical degree from Drexel University College of Medicine, and she completed her internship at Boston University and residency at Rutgers Robert Wood Johnson Medical School. She has been in the game, y'all, for over 20 years, making moves, empowering the community. And I am so glad Dr. Niles is here with us today. She's beautiful. Look at her. Dr. Niles, welcome to In the Kitchen.
Thank you. Thank you for having me.
You are so welcome. So you have been a primary care physician. Like I said, you've been in the game over 20 years.
Yes.
You've been changing lives, family lives. You've done a lot of work. I think even in the church space, the faith-based community, you've done a lot of work there. I remember that. I think I was probably in college around that time. But could you just tell us, first of all, what is a primary care physician and what are the types of different people who practice primary care?
Okay. So primary care is really a person's first introduction to the medical team. You know, when you have an illness, you generally want to start with someone who's in primary care. That could be, depending on your age, it could be a pediatrician. Most pediatricians take care of people up to the age of 21. Some stop at 18. It can be an internist who takes care, generally, some internists will take care of age 12 and up. It could be a family medicine physician, such as myself, who takes care of what we call cradle to the grave, from birth to death. So we really take care of any age. We're trained to take care of everyone, anyone and everyone. And that's really what you want to start with, not directly going to someone who's a specialist, like a neurologist or a cardiologist. Because, you know, you want to, sometimes what you think is wrong with you may not be what's wrong with you. And you want someone who's trained, you know, in medicine and trained to deal with symptomatology and to know, you know, how to diagnose you, what tests to run, and so forth.
100%, and I think I'm good for that. Like, okay, I think this is it. WebMD will kill you guys. Be careful. Yes, and that is the power of that, having that almost gatekeeper, if you will, to know where things are and to save you money too in time
Yes.
running around. So, could you describe then the ideal relationship that we should have with our primary care physician, or that a primary care physician should have with their patients?
Yeah, you want to build a relationship of trust, and that goes with any relationship. In order for I tell my patients, and sometimes it takes several visits. You can't really uncover what's wrong with someone right away. It depends on how much time for the visit, whether it's 15 minutes, 20 minutes, 30 minutes, 45 minutes, or an hour. And then you have to tailor, depending on how much time, get as much history from the patient. And this is where it's important if patients can write down as much of their history. If they're young, try and get history from their parents as to what illnesses they have, because some things tend to be genetic. Not all conditions are genetic, but it's helpful to know if you're ill, what illnesses your parents or grandparents. For instance, if your blood pressure is elevated and you come in and you're in your 20s or 30s, I would want to know, did your parents have high blood pressure, and at what age were they diagnosed? And the same thing with your grandparents. So it's important to get as much history as you can, because 70% of our diagnosis roughly comes from the history you tell us. 20% we gather from the physical exam, and then another 10% roughly from any test we order or any studies. So it's really, really important. Really, I spend a lot of time talking to patients, because really that's the meat. If you don't get a good history, you're not going to get to the diagnosis in a timely fashion. So, and it's also important for patients to remember to try and be honest with their physician. This is where sometimes there could be a delay, like they're afraid they're going to be judged. I say right away, if I'm meeting you for the first time, I'm a friendly, bubbly person. I love what I do. I've been practicing medicine for a long time. And I know sometimes it's hard to pretty much say everything you do to a stranger. I mean, you're meeting a primary care physician or a doctor for the first time. You don't know them. And so that trust relationship takes time. You may not be able to do it in 15 minutes or an hour, whatever time you're given with that patient. So it's really, really important to try and connect, and for you to try and be honest about your symptoms. Yeah.
Ooh, okay. Well, listen, you just opened up a can of worms talking about that honesty and trust, and wow. I'm gonna go off script here a little bit, because I think that is almost the etiology or the root cause of why people don't feel comfortable sharing information,
Yeah.
because of the history from colonial times to present in this country
Yes.
around trusting your physician, trusting that person in the white coat. The person in the white coat hasn't always been a person that looks like you or I.
Yes.
And unfortunately, we are still seeing disparate care delivered throughout our health systems at all levels. We saw a lot of it happen during the pandemic, where I think collectively, and this is my opinion, trust was shattered with the medical community. I struggled with, do I trust
Yeah.
the governing public health body anymore? And I'm a public health professional, and I went through probably 18 or 20 months of struggling with, I have to figure out how to come to grips with how I feel about this, because
Yeah.
I still need to be a voice for change. I still need to help people overcome their trust now and how things are handled. All this in mind, we are somewhat through the thick of the pandemic. How do you encourage patients? And I kind of remember some of our first interviews, and I was puzzled, like, why is she asking me all these questions? How do you encourage patients to either open up to their provider, especially in the Black and Brown community, or identify the provider that works for them and not feel like they have to stay in a relationship that doesn't serve them well? because we want good outcomes. But if people feel like they have to stay or they can't speak up, they're not likely to, it's not going to be an effective relationship, and nobody wins in the end.
Yeah, I think a big part of the relationship is communication, and communication works two ways. If I'm asking you questions and you're not answering them, or I feel like sometimes it's like I call it pulling teeth, because patients, when you're omitting something and not telling something, and I have to figure out a way to get it out of you and ask, it's going to help me get to the diagnosis, especially if you're in pain or, you're having really, symptoms that I'm concerned about. You're really sick and I'm trying to get to a diagnosis. So, so communication works both ways. It's more than yes and no. Like I'll ask you a question, yes, well, can you expand on that? What type of pain? For instance, if you come in and you're telling me you have back pain, so I'm going to ask you what part of your back hurts? How long does it hurt for? Does it radiate to any part of your body? Like, for instance, do you get like an electric feeling that shoots down the back of your leg? When did the pain start? What makes the pain better? What makes the pain worse? All of that, believe it or not, really helps me hone in on what type of pain you have. For instance, if you told me the pain's been going on for 2 days, well, that's acute pain. Anything under, 30 days, is roughly our cutoff. Any pain that you have that's going on over 30 days becomes chronic. And that puts it in a whole separate category. So that's why it's really important to get your history, and sometimes if I can't figure out or put together what I'm being told, I'll reword the question really and ask the same thing again. And then I'll speak back and say, well, this is what I heard. Is this correct? Is this what your understanding of what's happening to you is? So the communication goes back and forth between me and the patient. And the patient has to participate. You can't just come into a doctor's office and just sit there. We don't, have telepathy. We can't figure out your history. We don't know, like if I ask, for instance, if you smoke, or if you do any drugs, some patients don't want to admit, if you come in, for instance, with chest pain and you're a young person, and, generally young people don't have heart disease, meaning like, cholesterol plaques leading to a heart attack. So they think they're having a heart attack because that's what they're reading online. They're Googling their symptoms. I know, because I know. And I can tell by the words sometimes they're using that they've been on the internet. So I have to ask about, drugs like cocaine, because drugs like cocaine cause the arteries in your heart to constrict, and that can lead to chest pain. And so if you don't tell your doctor that, and I went through this with a patient, I said, don't worry, no one's reading this chart but you. This chart doesn't go to anyone without your permission. And sometimes patients will tell you, but they'll say, don't put that in my chart. I've experienced that too. So you got to be honest, because I can't get to the diagnosis if I don't know what's causing your symptoms.
That's really important. And I really hope that people have heard the truth. You just spoke the power about that two-way communication and not holding back information. Like you said, it comes with that trust. I'm at the place now where I want to interview my provider. I look them up. I'm at everything, every digital footprint you have. Before I even walk in your office, I know who you are. I've made a conscious decision that there's going to be some foundational trust. So please don't disappoint me when I get there.
I know a lot of patients do it. I get a lot of referrals, patients online, or they'll talk to their friends. Sometimes I'll ask them how they got there, and it's someone referred them.
Mm-hmm. No, that's so important. So I want to stay on that and lean into the next question and talk about, or could you talk to us about why it's important to have, we're in January, right? Everybody's benefits just started over. Some of us are screaming about these deductibles. We have to pay for any type of, radiology or pathology we're getting done right
Yeah.
now. But that aside, this is also the time where some people can restart the clock and get their next well check or physical, whatever we want to call
Yes.
it. Can you talk about why that's important and what, if you can summarize just by decade, maybe up to age 60, I guess, what are the highlight of screenings we should be owning and asking our primary care provider for if we're not seeing that come as a part of our well check?
Yeah. So there's certain screenings that are important by age, in the pediatric community, you have your little milestones. You have a baby that's born, and then you go in for your 2-week checkup, your 4-week, your 6-week. During that period of time, important vaccinations, which is a whole nother can of worms. Um, that are recommended or given, and really up until the recommendations, and the recommendations change really throughout your lifetime is the best way to put it. For instance, women who are around age 50, depending on whether you have a history of breast cancer, the recommendations have changed, age 50, age 55. If you have a family member who has had breast cancer, you may start your screenings at an earlier age. That happened to me, actually. I had an aunt who had breast cancer. She was in her 50s. So I started screening. Actually, she was in her 40s when she was diagnosed. She was in her 50s when she passed away. So I started getting mammograms at age 35 because of that. I'll use myself as an example. So it's important to go to see a primary care physician so you can find out what you need to do and what screenings need to be done at your age. And again, they're always changing. Every year, I go to conferences, I'm always reading, and guidelines will come out on when to screen for mammograms. We used to screen for prostate by doing regular PSA blood test levels like 20 years ago. We stopped that because we found more harm was being done than good. You get these levels which could be falsely elevated by just doing a rectal exam. When you do a rectal exam, you're palpating and feeling the prostate, and that alone can elevate your PSA level if the patient goes to the lab within 10, 15 minutes, 30 minutes, and gets that blood test drawn. So over the years and decades, recommendations have changed, and we, try our best to abide by that and keep up with that. And it's really a lot to impact in a physical exam. So you want to give yourself time. You also, when you go in for a physical, put your list together, but realize in reality and realistically, you may not get everything covered, because there's a lot to do, when you're coming in for a physical. You're basically going over your history again. And I like to get family history to see, what's going on with your parents and your grandparents, and if there's anything that I need to screen you for because it runs in your family.
That's very, very helpful. And so you've already touched on this, but I want to call it out for our listeners. What purpose do physicals serve? We call them well checks in kids, but what purpose do these annual physicals serve us? Why should we be going to get these?
Yeah, so a well check serves really for you to come in, give a history as to what's going on. Are you currently having any issues, pain? How are you sleeping? How you're eating? We can check your weight. We can check your blood pressure. During a physical exam, I've had young patients come in their teens and their blood pressure is high. They're normal weight. Some of them are vegan. They're eating well, but it's that genetic component. And so it's important, if you come in for a physical, to let us do those things, get your temperature, weigh you, blood pressure, get your heart rate. We can pick up a lot from, we call them vital signs. We can pick up a lot from those 4 measures. And that's a basic start. And then you come in, you can update us on your history, how you're feeling that day, if you have any health issues going on or health concerns. And then we do the physical exam. The physical exam is important. If you come in for a physical, you're undressed, you're in a gown, we can look at your skin. We're generally, as primary care doctors, not dermatologists, but I do look at the skin. And if I see something that looks, funny or suspicious, I may say, hey, you may want to go see a dermatologist and get this checked out. We can listen to your heart, your lungs, just do a good exam. I find physicals helpful because a lot of patients don't really pay attention to their feet unless they have pain. And I can look at someone's feet and it's just something that it's so easy, and tell them, hey, you have bunions, which parent, and they always know which parent's feet they inherited. But I'll tell them, like, especially if it's like really looking like a bad bunion and they're young, they're in their like 20s or 30s, I'll tell them, you may want to start seeing a podiatrist, wear a wider width shoe in the interim, and get that checked out, so you won't necessarily need surgery down the line as that bunion worsens with time. So
I love
we
that.
can unpack a lot in a physical exam, things that I've had patients think that because they look at their skin every day, and there are different types of fungus that can grow in your skin, and I may just be listening to the lungs, and I'm, listening on your back, and then I see your skin and I notice, like, wow, you have this fungus looking pattern. How long have you had this? And they may not know, most fungus is not going to harm you. It doesn't hurt. Some fungus will cause itching and redness, but there's a type of fungus called Tinea versicolor, which changes the color of your skin, whether it's on your chest or your back. That's the most common location. And I'll point that out. If I have an opportunity to examine you, I'm going to let you know and say, hey, are you aware of what your back looks like, or what this is on your chest? And sometimes they're aware, sometimes they're not. So a physical exam can really point out a lot of things that you may or may not be aware of.
I love everything you just said, and I'm gonna tell you why. Because I think there is this fear of not wanting to know something's wrong that people
Yeah.
have, but at the same time, we want to know what's going on. So one, I hope our listeners have heard the importance and the power of why you should develop a relationship with your physician. It's probably not going to happen on the first visit, but you can do your due diligence by looking them up, talking to people, getting that referral, and then just keeping an open mind when you walk into that exam room. I want to point out, you said about getting undressed. So I've had a physician since I've been here in Atlanta, and when I started as a new patient, did not request me to take my clothes off. And I was like, are you sure you don't need me to get undressed? And it was like, yeah, it was like a pity pat thing. And I was just like, this clearly is not going to work. So would it be safe to say if there's a physician who's seeing you for the first time, not asking you to undress, that's probably not the right physician for you?
Yeah. I've been practicing medicine for a long time, and we as physicians we all go through the same training. I trained, I consider myself an old school physician. I do things, because I had some really, really good mentors and teachers, really good, that at the bedside didn't need CAT scans to diagnose your heart condition. Like, they can listen to your lungs, your heart, look at you, look at your fingernails. I'm telling you, really, really good. And that's who I trained under. And it really inspired me, to really, examine. That's that 20% of the puzzle that you need. You're getting the bulk of the, if the patient's a good historian and you get a good history, you can probably, without examining the patient, at least come up with what we call a differential diagnosis, which is a list of conditions that the patient may have. But that physical exam really is going to help you hone in on and shorten that list. So it's important. And I have patients undressed because I'm gonna give you a perfect example. And this happened um, over 20 years ago. I had a kid come in for a physical. He was a teenager. He played football in high school. I don't know if he ever undressed like for his previous physicians. So I had him put a gown on. And back then we were doing testicular exams, more regularly. Now we have patients do like self exams at home, just like we have women doing breast exams at home. We still do those in the office too, but we get a chaperone and things are different now compared to 20, 30, years ago. And I remember I had him undress and he had this hernia and it was so large you couldn't miss it. I didn't even have to examine him. Like I just looked and I was like, what is that? And I said, how long have you had that? He said, for about 2 years. I said, does it hurt? I knew it hurt. Like it looked like it hurt. He said, yes. And I said, you play football and you run with, it was huge. It was like bigger than a baseball, like it was melon size. And I said, when you run, that hurts, right? Like I knew it hurt. And he said, yes. And I immediately referred him to see a surgeon so he can get evaluated and get surgery. I knew. So had he not undressed, he would have continued to walk around with that. He didn't come in complaining of, I have this thing in my groin that hurts and that's hanging and that's been, there for 2 years. He came in for a physical. And because I had him undressed, I was able to see, like, what is that? That didn't belong there.
Wow. Yo, this is why she's the best. This is why I'm about to just take my care back to Philadelphia and be flying in for my visits. So since we're talking about the male species here, I have a burning question. So, there's this thought or belief that men don't necessarily want to own their health and lead, if you will, in that area. And what can we do to inspire our men, not just brown and black men, but all men, to recognize that it is a male thing. It's a dude thing to go and get evaluated. You are essentially providers of families, and I think it's a good thing to have children see their fathers leading or uncles leading or brothers leading in that area as well. So what can we do to help inspire our men to stand up in that area and own it and not depend on their wives to set their appointments? No, to do it yourself. That's a level of responsibility that they need.
I think just how men approach their day, they put it on their calendar and they take care of it. They do it. They don't ignore any symptoms they're having. Maybe 20 years ago, I found a lot of men would come in with their significant other or their wives. Today, I think more men are proactive because there's a lot of health information out there. In addition to the internet, we have social media. And so, social media plays a part of all of our lives and we see information. So I think because information is in a form where they can digest it and understand it, and a lot of the fears that they may have had or reasons why they avoided going to the doctor. I am seeing a lot more men come in because of that. So I think you just have to make a commitment to do it. Put it on the calendar, go in and get a physical, talk about the issues that you may be having, and go from there. I know during the pandemic, we saw a lot more men come in. They were dealing with, like a lot of people were dealing with, we didn't really touch upon mental health, but that's a big thing that we do as primary care physicians. And as a family physician, we're trained in mental health. Psychiatry is the field where people generally go for mental health, but there are other fields, and other providers that are trained in mental health. And actually, a lot of my patients prefer to start with me as a primary care physician because they have that relationship with me, and there's trust, especially in the Afro-American community, where some of that trust may have been lost or just hasn't been built over the years. So they feel more comfortable talking to you, as a primary care physician before you send them out to see a psychiatrist, someone they don't have a relationship with.
I think that is powerful, what you just said. You keep saying the key words here: relationships and trust. And, sometimes crisis tends to be our best teacher. And I believe that we shouldn't even get to that point. And what I mean by that is some of us didn't even realize the value of relationships until the pandemic came.
Yes.
And, you know what I mean? So now it's like, oh,
Yes.
what's really important? So, oh, I need somebody I can trust to talk about this. I am struggling with filling in blanks, so I'm so grateful for you, because you're just the power that is coming from your vocal cords right now it's monumental. It's paramount, because we didn't touch on mental health, but that's so important. And I guess there's a stigma that says if I say I'm not feeling myself, then they're going to just send me to a shrink, which, by the way, these people went to school. We should stop calling them shrinks. They're psychiatrists or psychologists or mental health therapists. But
right.
Stop doing that, people. They deserve more credit than that. There's a whole conversation about mental health and food. I have a saying called gut health plus movement equals mental health. Yes. I know there are some things that could be genetic, and typically that's these are my thoughts. Certainly you can correct me, but typically that's not the norm. It's like the exception to the rule. Some of it is unresolved lifestyle experiences that we've rehearsed, and we've created these pathways in our brains, and our brains have identified this as normal. This is true. This is the narrative that you've taught this computer. Other challenges that we experience combined with life is we're eating food that is more inflammatory in nature than we've ever had probably in the last 2 decades. I was just reading last night more about, I'm very interested in the history of food in America and globally. And I look at patterns of when processed food really got introduced, when fast food was really introduced, and then what diseases began to show up all of a sudden as a result of these shifts in things like convenience or social status. Went from big parties to how much food you can serve, to meat and potatoes generation, to, let's add more vegetables in, and there we're kind of back to processed food. And I don't know that people really realize that your first line of defense, your gut, your immunity resides in your gut. I was just telling my mom last night about the power of vaginal deliveries and how babies actually swallow some things coming out. And it sounds gross. I grossed my niece out. I was like, but it colonizes your gut. And babies that are born by C-section, unfortunately, are colonized by the skin of the hospital and all the microbes that are around. It's just different. So anyway, there's a whole science to that. But what I guess I'm getting at when we're talking about mental health is looking at what we're eating, but also being okay with saying, Dr. Niles, I'm not okay today. It doesn't mean that you have a lifelong diagnosis of depression or anxiety and anything like that. So can we talk about, on the one hand, as a patient, how would you inspire us to just raise our hands to be okay to say we're not okay? And then two, on the physician side, what can physicians do to create a safe space? Because during, and this is a part of my medical docuseries, so I won't get too much into it, but one of the people on my comprehensive care team when I was recovering from this traumatic brain injury, more in the acute phase, was he was some sort of psychiatrist or something that specialized in, head trauma. And I walked in his office and immediately he was just looking for, does she need medication? And I'm just saying, I'm not myself. I'm struggling with not being at baseline. I don't sleep well. I don't have an appetite. Like, I have all these things because my brain is still trying to recalibrate.
Yeah.
And I felt like, man, he didn't really see me. He didn't hear anything I said. He's like, well, you don't need medication, so I don't need you, there's nothing I can do. And I was like, so it's all about medication. So how do we get providers to create that safe space and not make it about just medication or just a diagnosis, but just to say, hey, it's okay. We all have stress in our life. Like, what is that balance? And as a patient, maybe how can we manage up if it's even possible?
In in the mental health space, I tell patients to do their homework. Generally, if you come in to see me and, as a family physician, we're trained in diagnosing anxiety, depression, other mental health conditions. And depending on our training and our comfort level, and our practice and practice style, we may feel comfortable taking care of certain types of conditions, and others we want to refer out. And I think when you're looking for a mental health provider, whether it's a psychologist, psychiatrist, or therapist, someone who's giving you therapy, it's important to learn about the practice and what they treat. And for instance, some psychiatrists will do therapy and prescribe medicines. So instead of seeing, a lot of patients have a therapist who generally has either a degree in social work or they have a PhD in psychology, and you're getting therapy. You're sitting, which is when you're sitting and you're talking to that therapist for X amount of time, 30 minutes, an hour. I think these sessions are generally an hour, but those therapists can't prescribe medication. And then some psychiatrists don't do therapy, they just prescribe medications. So it's important before you walk into that psychiatrist's office, if you can find out so you don't get disappointed, I try and give my patients a list of psychiatrists. Generally, that list will have, what they treat. If I know what conditions they cover, sometimes it may or may not have what insurances they take, which is a whole nother area when it comes to mental health. But it's important to know so you won't be disappointed if you're going to get therapy from that psychiatrist. Some psychiatrists will not prescribe medication unless they are doing the therapy or unless you have a therapist. So you have to make a decision. Most people start with a therapist, unless they're referred, or they can self-refer to a psychiatrist if they think they need medication. I have some patients where anxiety or depression will run in their family. They'll see what their mom or their dad has gone through. They come in and they already know, look, this is what my mom's on. And then they'll tell me, I think I need meds. And if so, can we start with this because it's working well for mom? Because sometimes, it is helpful to, if you get that history, if the mother has the same condition or the father, and I've diagnosed them with the same illness, sometimes I will honor, what the patient, it's a discussion. It's, I have to agree like that's the best medication for them, because it may not be. Just because their parents is on it doesn't mean it may be right for them. So, so all of that, we take into consideration during the visit. But it's definitely important to know and to at least find out when you call to make that appointment with a mental health provider, what services they provide, what conditions they treat, of course, the insurance. Because a common complaint I get is where patients will go see a therapist or they go see a psychiatrist and they don't want to continue to pay that money. So they want to come see me as primary care to try and do all of it, which sometimes I can do, but sometimes I can't if it's out of the realm of my of what I do. Certain conditions, certain psychiatric conditions are best handled and taken care of by a psychiatrist. Let's put it like that.
I agree. And that's just it's so good. So I think you differentiated the difference between a psychiatrist, ones that actually can give medication, a psychologist, as well as the therapist, and kind of their different realms. And, even as much as we look up our PCPs or cardiologists, we should be looking up our mental health providers, or our brain health. Maybe we should say it that way. Our brain health doctors as well. I know sometimes you don't get a choice, like if you're in a comprehensive program for something like a TBI, you don't get a choice.
Yeah.
Send somebody in like, hey, let's talk. How are you? But most of us have a choice. And I think talk therapy is what is effective for a lot of people. Like you said, some people may not need medication. And I'm of the belief that, like sometimes medication is important, but hey, can we look at what you're eating?
Yeah.
How do you feel after you eat? There's probably some, coexisting things in your gut that if we change your diet, even temporarily, you could pass some of that out and some of the inflammation will go down and you'll feel a lot better.
Definitely. I agree. The gut health is like key. And that is so important, what you're eating, because your gut is your immune system. That's the first place, where your body is in contact outside of the skin, and your immune system is there, and it's going to take reaction to what you're putting in it.
That is so true. Oh my God. So, I just looked at something the other day that showed how the research being published on the gut microbiome has grown exponentially just in the last decade. It used to be like this, and now the chart goes like this for PubMed publications and searches and all of that. So it's critically important. And I'm just glad we're talking about mental health. So I'll put a plug in to say, if you are needing help, if you're in a situation where you're not sure, even if you need somebody to talk to, we changed in the public health profession. I'll take credit for this, right? We can take credit for this. The number from a big 1-800 number to just 988.
Yeah.
You can call and have a conversation with someone. You can cry your eyes out. No one knows you called but you. You talk to that therapist or whoever answers the phone, and be open with them about it. Maybe that's what you need. So wanted to put a plug into that since we leaned into mental health today, which I'm so glad we did. So men, yes, I'm glad that we are seeing, Dr. Niles, you're seeing that men are owning their healthcare more. It is a sign of strength and machismoism, if you will, to own your health and be okay. And I know, guys, I've talked to some of you, you feel violated when you have to get those exams, but trust me, they are not as invasive as ours. So please put your pride aside. Get your testicular exams, get your rectal exams, make sure that you are taking care of yourself from head to toe, from the inside out. So that's my plug for men, because men, you matter. Your health matters just as much as our health does as women.
Yeah.
All right. So we jumped into food, and I usually like to wrap up my time with this quote. So as a medical doctor, we often say, Eat fruits and vegetables. I'm going to read it because I'm losing my words here. So here's the trend. The answer to preventing and remediating most illnesses and diseases begins with the following statement. Live a healthy lifestyle, eat whole fruits and vegetables, avoid processed foods and sugar, and remain physically active to keep not only a healthy heart, but your cholesterol and your blood sugar levels at optimal levels to prevent disease. Is that a statement that is still true today, or has the narrative changed?
I think the statement is true today. I think what patients what people need to remember is everything in moderation and living a balanced lifestyle. The basic things like, our bodies are made of mostly water, like 60, 70%, depending on what you read. So it's important to replenish our bodies with water every day. Soda doesn't count as water. It's a carbonated drink, and I'm going to explain why. The the phosphate that's in soda competes with the calcium in your bones, and can cause you to eventually, over time, suffer with bone loss, osteopenia, which is what we call it. I know because I did my little experiment. I had a bone scan done, and it showed that I had some bone loss. And I'm like, wow, where is that coming from? Like, it's not Afro-American women. It's usually Caucasian or Asian women who generally suffer from that, but we as Afro-Americans can also too. And so I did a whole year where I cut soda out of my diet. My scan went back to normal. Like, so I know it was what I was putting in my
Wow.
body, because I was like not of that age where I should have like what we call osteopenia. And so it's important to have balance. Some people think they can thrive off of 3 to 4 to 5 hours of sleep, but your body really needs minimum 6, preferably 8 hours of sleep a day. Why do you need 8 hours of sleep per day? Because you're running around the rest of that time, eating, drinking, thinking, running, working, taking care of people, and your body needs to rest. What is your body doing during that period, 8-hour period? It's rebuilding, it's regenerating, it's rejuvenating. When I have patients who are ill with flu-like illnesses, I encourage them, instead of 8 hours, get an extra 2, because you're already sick. You can't do anything. You can't go to work. And I've practiced this. I know, like, on days I don't feel well, I'll try and I'll intake extra water and definitely get extra sleep. An extra 2 hours, that's 2 hours where your body is resting. When you're resting, when you're sleeping, your heart rate goes down, your blood pressure generally goes down, even your body temperature goes down. Why? So you can rest, so your gut, everything slows down. You're not having that urge to go to the bathroom when you're asleep, because everything slows down. That's why when you wake up and you start moving around and walking around, if you have a normal, healthy body, you're going to want to urinate and you're going to want to go to the bathroom to defecate, because those things, your body starts warming up, your body temperature starts going up, and your gastrointestinal system starts functioning and working. So within a period of time, you're going to need to use the restroom. But when you're asleep, most of those functions like pretty much slow down. And then your immune system and your body can repair itself and repair. We all have cancerous cells. We all have cells that don't belong in our body. When we're resting, we have killer cells in our body that are designed to kill cancer. They're designed to kill something you ingested that doesn't belong in your body. You know, I have a shellfish allergy. When I was 9, I ingested shellfish. The rest of my family was okay, but I wasn't. so you know, things happen during the day. And you may not be aware of it because you don't experience it as pain. You may be aware of it. You may feel nauseous or not feel well, or headache, you know, different signals your body will give you that something is, you know, going on in your body. And then it's up to us to take heed to those clues and do the appropriate action, whether it's to rest, drink water, go to the doctor, you know, all those things.
I mean, there it is again. Like that is just we have to have you back because we can talk so much more about sleep, mental health, even the generating what did you say generational wealth financially. Like,
yes,
that's not just a thing financially. Like, we are such complex, you know, human beings,
yes,
and our health and our wellness all touches financial, occupational, nutritional, physical fitness, family, social. It's all connected, and we can't continue to silo out these things because it's all connected. You talked about insurance.
yes,
That's a
which is
financial
why
thing.
yes, which is why I wrote the book, The Secrets of Financial Health for Women, you know, because I felt women generally, you know, at least in my generation, we didn't get that money talk. It was usually the men in the family. They knew more about finances. You know, I've friends my age, they, you know, a lot of us just didn't know. I started reading, you know, and I got a financial advisor. So, you know, I was able to get that information, and through my reading and learning and just sharing my experiences, I put it all together in a book, and it's blessed a lot of people. So,
Well, we're going to put the link for that book in the description below because we want other women and even men to read this
yes,
book and learn all
it's
that.
on Amazon.
Yeah, we're
And
gonna put that link below. We're gonna try to get more people to know
yes,
about the work that you have done and your experiences. I think that is so powerful. Let me pull up my notes once more. I feel like I'm losing my words again, but that's a part of recovery.
yes, you're
So
doing a great job.
thank you. Thank you so much. I wanted to lean into what you said as we concluded, and it has escaped me, but that's okay. Um, Maybe it's not meant for me to say. So, to our listeners today, who either is that person who doesn't go to the doctor for whatever reason, or who has a loved one who's like, you know what, that's not for me. I don't need that stuff. I'm fine. My parents ain't never go, and they fine. You know, some of this, I don't want to be insensitive about how I describe this, but we don't love our planet the way we used to. We don't love our animals the way we used to. And so the narrative that you don't need a doctor doesn't really apply in this day
Yeah.
and age. We need, God has given each of us gifts, talents, and our purpose for existence. You are clearly walking in yours. I am walking in
Thank
mine.
you.
You are so welcome. So we need each other. Like, we can't do it all. I think that's where I was going to go with this. We can't do everything. We need our community. So what would you tell that person that's on the fence about just just opening their hearts to the possibility that they could use some medical support, nutritional support, financial support, whatever it is? What do you tell them to just say, you know what, I'm gonna just draw a line in the sand. This is the new year, it's 2023. There's all kinds of quotes and sayings going around for 2023.
Yeah. Yeah.
How do we get them in your office? Whether it's your office or how do we get them in your office?
They call and make an appointment. If you don't know someone in your area, talk to family and friends. That's generally a good place to start, to find out what their experience is like with their physician or provider, and then go from there. Sometimes when you call doctor's offices, the front desk staff is very knowledgeable as to who in the practice is good at taking care of certain illnesses. And sometimes they can guide patients and say, hey, I think you should see Dr. So-and-so. So if by the time they call to make an appointment, if they haven't identified a provider, they can talk to the front desk. Sometimes the front desk can make a recommendation based on what their symptoms are or what they want. If it's a general checkup, a physical, that sort of thing. And I would say to do it, just like Nike says, just do it. Just do it. That's the only way it's going to happen. Just do it. This is a brand new year. This is January 2023. I love this time of the year where you sit down and you outline what you're going to do. And really, for me, the Bible says, when you have a vision, write it down, make it plain. The things that I have been able to do in my life, I've been successful at doing because I've spoken it when I was 5 years old. I said I wanted to be a doctor. And everyone who's known me since I was 5, they're like, wow, you've been talking about wanting to be a doctor, and wow, you've done it. And you find out, what you need to do to get to that pathway or where you're desiring to go, and you do it. You just do it.
Amen. And I love that. And that's what it is. Just one foot in front of the other. And it doesn't have to be perfect. I don't want enemy to be the perfect here. Colin Powell said something that really blessed me as an overachiever in my life. He was like, sometimes you just got to shoot from the hip. If you have 70% of the information, and if I'm misquoting him, just go look up the quote and you'll see what I'm trying to say. 70% of the information, that's enough to make a decision, or 75% something like that. Just go.
Yeah.
And, I started this podcast with a brain injury. It has not been perfect. I read, I lose my words sometimes, but you know what? I'm putting one foot in front of the other. I'm learning and I'm growing along the way.
And you're doing a good job, because it's that positivity and that energy that you've always put out since I've known you, and you stay committed and you're focused. Like, I've known you for a long time, and I'm like so impressed with what you're doing and how you're touching the world and, the community. So this is awesome. Just keep doing what you're doing.
Thank you so much. You are such a beautiful spirit. So on that, that this is that time of year where we do the Keep It Moving Challenge with the American Public Health Association. So I'm partnering with them. So I'm going to put a little blurb in about that as we close out. If you have not already, join Team iEatMorePlants. All you have to do is download the Keep It Moving Challenge app. And then you join the team, iEatMorePlants, one word. And you can sync your tracker, whether it's Fitbit, Garmin, Apple Health, Google Fit. And if you don't have one, don't worry about buying one. Just log in your activity and it'll convert it to steps. But the idea is movement is medicine, just as food is medicine. And so as you join the team and partner with your doctor, as you embrace a personalized lifestyle, physical activity and whole plant food eating, and making that phone call to set up your appointment for the year, do it so that your provider can help you monitor and adjust any medications or lifestyle factors that may be specific or unique to you to support the positive, healthy lifestyle changes you want to have. Dr. Niles, thank you so much for taking time today. It's such a pleasure to see you again. To be in your presence.
Same here. Thank you for having me. Ethel, this has really been good. Thank you.
I'm so excited. So I will definitely reach out when I am back up that way to say, hey, thank you so much.
Yes, thank you.
Happy New Year.
Happy New Year. You have a great day.
Thank you. You too. Bye-bye.